السلام عليكم. أنا دكتور نزار الصلاحات، المدير الطبي ورئيس قسم جراحة العظام والمفاصل في مستشفى بوخوا الدولي في بكين. قمنا في عدة حالات باستخدام الخلايا الجذعية لعلاج بعض الحالات في الإصابات وأمراض العظام، من أهمها اللي هي إصابة تنكس مفصل الركبة وشرحناه عدة مرات. الحالة اليوم إن شاء الله راح تكون عن مريض يدعى جيمس، عمره 54 سنة، كان يعاني من تنكس شديد في مفصل الحوض. قمت بعلاجه عن طريق الخلايا الجذعية المستخلصة من النسيج الدهني الموجود في البطن. حقنا للمريض 4 حقن. الحقنة الأولى كانت بخلايا جذعية مع صفيحات، وثم تبعتها ب3 حقن أخرى. إن شاء الله الفيديو هلا جيمس راح يشرح لكم عن وضعه أكثر ويخبركم الفرق عنده ما بعد العملية وكيف أموره، وهذا راح يكون إن شاء الله واضح في الفيديو القادم.
I'm Jamie Norman. I'm from Chicago, Illinois, USA, and I'm here in Beijing working for Disney English. And I was fortunate to find out about Hua Clinic when I had a cold. I have that Beijing cold that everybody gets when they first arrive, and I was treated very well and mentioned to Dr. Nizar about the pain and immobility in both my hips, and he took a great interest immediately, and we've been planning very carefully a strategy for many months now, and now today is operating day. Very excited about this. The biggest problem was that I would have stabbing pains in both hips at just any random moment. It didn't really matter what I was doing or when I was doing it. It would just happen. The second biggest problem was the lack of mobility. That I can't lift my legs properly. It's difficult to get up and down from the toilet, which is, that's twice a day. That's a real problem. Getting up out of bed, and other daily things. It was determined that I was an optimal candidate for total hip replacement. Well, I just didn't like that idea. I couldn't live with that I would never ever have my own hip again, and would always be dependent on hardware. I wanted my own body to be complete, and so I said no, absolutely not.
So we saw like severe limitation of movement for the hip joint. It was limiting the patients to go on for his daily habits, even go to wake up from the bed, sit down, standing up, going to toilet. Even he was not able to tie the shoe or putting his socks or whatever. All of these things, it was already annoying the patient. Since the patient, he's now already 54 years of age, and the total hip replacement, it was our choice. So we were thinking about some other treatment. Now, today we are going to start with him the stem cells therapy, and we're going to follow the case every month up to 6 months. After that, we can compare and we can see the clinical examination one more time.
How you doing?
He did 2 things. One was to perform arthroscopy on my left leg for an impingement. This is something that prevented the joint from moving, and also stem cell therapy to regrow the the cartilage that had been worn down. We went into surgery. Surgery didn't take long afterwards, and got me back to the room where I took a couple of days to recover. We had, after that, we had a series of injections. Then the first few days I needed help, and I was amazed as time went on how rapidly things were changing, how quickly I was healing, that this very minimally invasive surgery, that quickly I was able to stand up using the walker, to get around the house, and now it's 4 weeks. I've had the 4 injections, and so that's all over. We're now at just almost 28 days. I can stand up without assistance from a chair. I can get up off the toilet, no problem. So I think that the changes are coming, and there's more changes on the way. I want to do the other hip. This is, yes, yes, very much. It wasn't nearly as scary as I thought it was going to be, and the results are absolutely amazing. Yes, I want to do the other hip. It's really been a great experience that I'm already in a situation where I'm still healing from the surgery, but the stem cells, I think, are starting to work. The pain is much less. My mobility is increasing, and it's just all-around great experience. Thank you, Pua Clinic, Pua Hospital, Dr. Al-Salahat, and the whole team. It's just been a great experience.
So give to me. We don't need anymore. Okay?
Okay.
Come to me.
All right, here we go.
Yeah, faster.
Faster. There we go. Thank you so much.